Hello, everyone, and thank you for attending today. My name is Desmond Jensen. I'm a staff attorney here at the Public Health Law Center. And if this is your first webinar with us, we would encourage you to sign up for our mailing list to find out about other webinars that we host on tobacco control, healthy eating, and active living policy issues. If you haven't worked with us before, we provide a variety of services that we call legal technical assistance. We help with policy drafting, research. Our website is filled with publications, and we provide trainings like this one. We don't do any direct representation, and we don't do any lobbying, but if you require any other help with legal and policy issues in the public health realm, give us a call. We are particularly committed to addressing health equity. We believe very strongly that in everything that we do, we should be thinking about and considering how to address health disparities, which is just one of the reasons that we are thrilled to present today's webinar, because as I'm sure you all know, menthol has had a disparate impact on many underserved populations. We've been partnering with organizations like the African American Tobacco Control Leadership Council and the National African American Prevention Network to address menthol for years. This is the agenda for today. I'll start us off with just a little bit of background, and then I'll hand things over to Rob Cunningham to discuss lessons learned in Canada. Rob is a lawyer and senior policy analyst with the Canadian Cancer Society who has worked in tobacco control since 1998 and has made contributions to numerous initiatives supporting the adoption of tobacco control laws in Canada at the national, provincial, and municipal levels. He has appeared in court, including before the Supreme Court of Canada in tobacco cases, and has participated as an NGO representative at treaty negotiations for the World Health Organization Framework Convention on Tobacco Control. Rob is the author of the book Smoke and Mirrors, The Canadian Tobacco War. Next, we'll hear from my colleague Joelle Lester to discuss some of the legal issues related to menthol restrictions here in the U.S. Joelle is the lead senior staff attorney for strategic initiatives at the Public Health Law Center. She leads our FDA project, oversees our efforts to convene national thought leaders around bold policy options to end the tobacco epidemic, and organizes regional meetings to provide training and support to tobacco program managers around the country. Joelle also provides legal technical assistance on a wide range of tobacco control policy issues. Previously, Joelle was a litigator, lobbyist, and grassroots organizer for public education. And then we'll hear from Dr. Phil Gardner about advocacy efforts in the U.S. Dr. Gardner is a public health activist, administrator, evaluator, and researcher. Currently, Dr. Gardner is a social and behavioral sciences and neurosciences and nicotine dependence research administrator for the Tobacco-Related Disease Research Program at the University of California Office of the President. He's also an adjunct faculty member at Touro University in Vallejo, a graduate medical college, where he teaches a course on health disparities. And lastly, Dr. Gardner is the co-chair of the African American Tobacco Control Leadership Council, a group of Black professionals dedicated to fighting the scourge of tobacco impacting the African American community in California and nationally. After those presentations, we'll hopefully have plenty of time to answer some of your questions. All right, I want to start us off with some background, and I'll cover a little bit of information on the evidence base supporting action on menthol, and then we'll run through some of the latest actions on menthol around the world. There are three important conclusions that one can draw from the evidence base related to menthol, and the first is that menthol is an initiation product. Were it not for menthol, millions of people would not have started smoking. This is data published by the CDC showing the use of flavored products by high school students in the US in 2014. And you can see that the bar for cigarettes is split almost in half between flavored and non-flavored products. And of course, when we're talking about cigarettes, there is only one flavor out there since the Tobacco Control Act prohibited all flavors but menthol. This is an unacceptably high portion of kids who are smoking menthol cigarettes. We also know from several large-scale studies that menthol use rates are inversely proportional to age. This means that the youngest smokers are the most likely to smoke menthol cigarettes. There are a lot of potential explanations for this, but what is certain is that menthol products are exceptionally attractive to youth and young adults. And while we've made tremendous progress in tobacco control since the 1960s, and by all measures, cigarette smoking rates are on the decline. However, the rate of decline in menthol use is not matching up with non-menthol use. In fact, if we look at particular age groups, the trends are very different. The rates of decline among youth has slowed down considerably. And as you can see again, menthol use eclipsed non-menthol use quite a few years back. Among young adults, the rate of menthol use has actually increased over the last decade, and now has also surpassed non-menthol use. And menthol use among adults is virtually flat, while non-menthol use is on a steady decline. The second important conclusion that we can draw about menthol is that the use of menthol cigarettes decreases cessation. There is a growing body of evidence that is demonstrating that while menthol smokers attempt to quit more often, their success rates are significantly lower than non-menthol smokers. And this is particularly true in certain racial and ethnic groups. Which leads us to our third important conclusion. The rates of use of menthol cigarettes are very different across racial and ethnic groups, and this is not coincidental. This is the result of decades of marketing efforts by the tobacco industry. Menthol is a large driver of health disparities as a result of tobacco use, and we'll hear more from Dr. Gardner about that topic. Now, before I turn things over to our fantastic panel, I want to highlight some recent progress on menthol that some of you may not be aware of. Outside of North America, a handful of countries have passed policies, and Ethiopia and Uganda have actually implemented their policies. The EU and 2 of its potential future member states will implement their prohibitions in 2020. We also saw Brazil and Chile leading the way back in 2012, but neither of them have been able to fully implement their policies just yet. You're going to hear much more from our presenters on some of the action here in North America, but it's worth seeing at least a partial list now so that you can get an idea of how much is really going on. Many of these laws are already in effect and others go into effect soon. Now, hopefully the momentum that we're seeing here in the US translates into action by states and eventually by the FDA. And with that, to talk about everything that's been going on in Canada, it's my great pleasure to turn things over to Rob Cunningham.
Okay, so just to make sure I can get control. Okay, good. So I will talk about the Canadian experience. Thank you very much to Joelle and Desmond. It's great to be able to participate with everyone today. Okay. I'm having a little bit more trouble switching. Let's hope maybe I've got it now. So just as a quick overview, in terms of Canada, 10 Canadian provinces, 3 territories in the north that are sparsely populated. On the very far right in the east is Nova Scotia, which was the first place in the world to ban menthol cigarettes. 36 million people. We're bilingual English and French. You see our Prime Minister there, Justin Trudeau. Our smoking prevalence is comparable to the US in general terms, 18% current smoking, 14% daily, down from 50% in 1965. At that time, the US was at 42%, so we started higher. Like in the US, we're seeing tremendous declines in smoking among youth, 28% to 10% between 99 and 2015 for 15 to 19-year-olds. And as in many countries, the 3 major companies that we have that dominate more than 95% of the market are affiliates of British American Tobacco, that's the sister of Reynolds American, the subsidiary of Philip Morris International, and the subsidiary of Japan Tobacco International. Some examples of menthol packages in Canada. Our brand names, not entirely, but in large part, are different than the major brand names in the United States. It's been a long-standing flavor in the US, in Canada as in the US, going back almost 100 years. Our market share is much smaller than in the US, so about 4.5% of the market prior to the legislative changes. In Canada, although we're a very diverse country in terms of our population, menthol use has not been identified by minority communities, as is the case in the US. And you know, like the African Canadian population is perhaps just a couple of % of the Canadian population, which is very different than for the African American population. 7 of 10 provinces have banned menthol in cigarettes, and our menthol bans apply to all retailers without exception. So there's no exceptions for tobacconists or for stores that are adults only. There's no exceptions for duty-free stores. There's no exceptions for stores a certain distance away from a school. It applies to all retailers, including on a reserve, a First Nations reserve, our equivalent of a tribal reserve within a province. And so here you have the implementation dates. Nova Scotia being first. So Nova Scotia is now into its third year. We now have more than 80% of the Canadian population covered. And for a couple of provinces, Alberta and Ontario, had staggered implementation dates, so a longer transition period for menthol. And so the ban on other flavored products had an earlier date. These are the dates for menthol in this slide. And great news that we have a national ban on menthol pending. It's through legislative change. It's going to come into force in just a couple of weeks, October 2nd, at retail. I mean, it's the same date for manufacturers as well. It applies to cigarettes, to most cigars, and to blunt wraps, but not other tobacco products. Although other tobacco products may be covered at the provincial level, and in most cases they are, with a few exceptions. And it bans menthol at any level, not just characterizing levels of flavor. This is in terms of the federal legislation. Our provincial laws ban characterizing flavors. The wording is different, and New Brunswick is different, but overall, that's the provincial approach. But federally, you cannot have the tiniest level of menthol would be illegal. So this graph shows the long-term trend for market share of menthol in Canada. The blue line is Canada. And you see it's been around 4.5% of the market for the last 15 years. Now, there was an uptick in 2016 that's associated with the launch of capsule cigarettes. And that sort of brown line for British Columbia, this incredible spike. Now, British Columbia had not banned menthol cigarettes. The capsules were introduced, and this incredible spike in terms of market share for menthol, including capsules, doubling from 6 to 12.5%. And this was similar to other provinces that did not yet have legislation banning menthol, and I'll come back to that. But I think it just highlights the importance of banning menthol before the situation gets even worse, and companies are able to innovate and do more things to further entrench their position. The Canadian story is intricately connected to other flavored products. So it was a ban on flavors, including menthol. And it started really about 10 years ago with the increasing sales volume of flavored little cigars, cigarillos, these cherry and grape and peach and vanilla flavors, colorful packaging. They had because they're cigars, they had different health warning requirements. You don't see those picture warnings on them. There's just a smaller warning on the back. And that prompted, different levels of action. And just more examples, chocolate and raspberry and peach. And here's some very small packages. Twinkle, we know Twinkle, Twinkle Little Star. There's only 4 in each package, and they're very small. And so that was objectionable. And then when the results in 2008 were released, so these products were appearing on store shelves. And, that was of concern, and we raised this with government. But in 2006 and 2007, this school year for the smoking survey, released in 2008, we had some data, and that we had significant youth use of cigarillos. So we got some media coverage out of that, which prompted in the election campaign nationally later that year, the Prime Minister, leader of the Conservative Party, announcing a party platform commitment to ban these products. With the new Parliament, this is the Minister of Health, a bill was introduced to ban flavored cigarettes, little cigars, blunt wraps, but with an exception for menthol. And this bill passed. Cigarillos were defined as little cigars 1.4 grams or less, or with a cigarette filter. And of course, we wanted a ban on menthol at the time, but there was not available to us the data with respect to youth use of menthol. That would become later available. Now, once this was implemented, the companies responded by simply having the little cigars weigh a little bit more than 1.4 grams. So the Bullseye cigarillos became Bullseye cigars, but still strawberry, grape, and a similar flavor. So the problem was addressed somewhat, but still continued. And so we kept pressing for action. more examples of before and after for this little cigar. And of course, we would show these to members of parliament or politicians or the media, and they wouldn't be familiar with them. Their kids, teenagers might be familiar with them. And so when they saw packages like this, they thought it was just very objectionable and something should be done about it. And here we have individually packaged little cigars that were very inexpensive, and again, with these flavors, sold individually. Blunt's type of cigar on the far left is chocolate. And again, lots of different flavors. In Canada, smokeless tobacco use is comparatively quite small compared to the United States, but it's been heavily flavored. Water pipe tobacco is really growing, and that's a concern in Canada. So in 2013, we had this survey, a more updated survey for the smoking survey results released in a special report by the Propel Center for Population Health Impact. And it's similar to the data that Desmond highlighted at the beginning of this webinar for the United States. 52% of high school students who use tobacco, 52% use flavored tobacco. Of high school students who smoke, 32% smoke menthol. So we had a coordinated national release of this data, national news release, provincial news releases, showed packages to the media, and we had considerable media coverage. And those numbers are really striking. And then a year later, there was another survey released, updated, more recent year, of high school students who use tobacco, 50% use flavored tobacco. And the release of these studies was a game changer in our debate. And it really prompted provincial legislatures to be taking action, these two surveys. So to emphasize, 50%, this is my emphasis by font size. And, Desmond's had similar figures that he's presented at the beginning. It's huge. 50% of high school students use tobacco use flavored tobacco. That's a huge problem. And for this more recent survey of high school students who smoke, 29% smoke menthol. It gets worse, because of high school students who smoke daily, 43% smoke menthol. And of high school students who smoke menthol, they smoke more cigarettes per week and are more likely to intend to continue smoking next year. And that was published as a separate study. But this compared to only 4.5% of cigarettes sold in Canada being menthol. So youth, high school students were using this way more than the general population. Again, 29% emphasizing by font size. And this data was just cited repeatedly in our advocacy efforts and by governments when they move forward with legislation. And these studies were released in 2013, 2014, and in early 2015, Nova Scotia had their legislation adopted in force. That's very quick. One of the ways that we presented the data was to give actual numbers. So this percentage is one thing, but what does it represent in terms of actual numbers of high school students? So, 137,000 high school students using flavored tobacco, or more than 50,000 high school students using menthol cigarettes. And we could have provincial breakdown. So in such and such a province, whether it was British Columbia or Ontario or any province, there could be numbers. And that was helpful to put that in context for local political and other decision makers. So our ban on, or I guess our partial ban on flavored cigars did have some impact. So this is data in terms of grade 10 to 12 students from the e-smoking survey, which had a new name, the Canadian Student Tobacco, Alcohol and Drug Survey, but same methodology. It had gotten to a lot. And I know this is a growing issue in the United States. 17% of grade 10 to 12 students were smoking, had smoked, or current smokers of little cigars or cigars. That decreased to 11% after the Bill C-32 was in effect. It decreased again to 9%, but still very substantial. And they were almost all flavored. And this data is encouraging. Now, it's cigars, but it shows how flavor bans can make some progress. And so there's tremendous growth in the flavored little cigar sales in Canada. And that growth was arrested, and there was a decline following the implementation of Bill C-32. And in more recent years, as we've had more restricted provincial measures and federal measures, there's been a continuing decline, but we're still not there yet. A couple of provinces exempt some larger cigars, some ban flavors in all cigars. Some provinces, there's variance, but we can hope for further declines. So these are just some illustrations of provincial legislatures, among those who acted early. And this is where the action was and where there were results. On the top left is the Minister of Health in the province of Alberta announcing the menthol ban in that province, flanked by representatives of Action on Smoking Health, the Canadian Cancer Society, youth. Bottom left are advocates from Ontario, including youth advocates. On the right is Prince Edward Island advocates. And again, just various stunts or advocacy initiatives here involving youth outside the Ontario legislature, a news event that did generate some coverage. And again, having these packages at hand really is attention getting, because reporters just can't believe what's on the market. And it was always a ban on flavored tobacco, including menthol. But these other products were very helpful in making their case. A poster that was used, comparing flavored products, tobacco products with candy. Here is the implementation in Nova Scotia at an event just ahead of World No Tobacco Day, May 31st, 2015. On the far right is the health minister. You have the provincial medical officer of health. You have representative, again, of youth, Canadian Cancer Society, the health community. So they were celebrating, setting the world first to ban menthol. Nova Scotia's population is about 1 million. So again, you have the listing that you've previously seen with respect to implementation dates for provinces in Canada and nationally. And one very interesting thing is that in many other countries, flavored capsules, especially menthol capsules, have been on the market and had tremendous success. But they never introduced them in Canada. And they were only launched in Canada after, going through the legislative process with a government majority, or adopted in Ontario, Quebec, and New Brunswick. So with legislation about to ban them, they introduced them. Here are some examples of the menthol capsules. You see the 75% health warning on Canadian packages. You see the promotion inside the package so you have Canadian Classics Crush, Benson Hedges Unison, Next Snap, or Belmont Hybrid. Some examples, and other companies would introduce their own as well. And then they introduced double squeezable flavor capsules the year later, at least for Pall Mall. So the industry arguments, first of all, they argued that menthol was not popular among youth. Well, we were able to contradict them with data. They argued that bans would not affect youth smoking. They said it would cause contraband. Adults should be able to choose. Menthol has been sold in Canada since the 1930s. So the major tobacco companies did not oppose the bans on flavored little cigars and all those other non-cigarette products. They didn't sell them for the most part, but they objected to a ban on menthol. So they tried to distinguish menthol from the other flavored products. I mean, it was really hard, for the major cigarette companies in Canada to say it was justified to have chocolate little cigars and grape, and it was hard to justify those products. The opponents we faced, the arguments and the opponents, I think, are similar in the United States and Canada. The major tobacco companies, convenience store associations, National Coalition Against Contraband Tobacco, it's funded by the industry. The smaller tobacco companies selling the other flavored tobacco products. And it was constant effort by us to expose the tobacco industry funding to these convenience store associations or the coalitions, and that was effective. We've already seen with respect to the international trend. In the case of Ethiopia and Uganda, there's not really a menthol market in those countries, but very good to take preemptive action. In the EU, so they have a ban on capsules that's already in force. So that was an interim step they took. The industry lobbied very hard for there to be not a menthol ban in the EU directive, and which I think is telling how important it is for us to ban menthol. If this was not going to be effective, they wouldn't be lobbying so hard against it. And in the EU, it's such a diverse makeup of 28 countries. I think the market share probably ranges from a low of 3 or 4%. I think Poland's a high of around 21%, which explained in part, I think, the longer implementation period within the EU. One of the aspects of legislation we see in Canada to make enforcement easy is to say that any packaging referring to a banned flavor is illegal itself. So if there's a law that bans menthol, the package says menthol, it's illegal. It can be seized. So that really makes it easy for enforcement. One example of a wording in Canada, this is from the federal legislation: no person shall package a tobacco product in a manner that suggests, including through illustrations, that it contains a banned added flavor. So if it says cherry or grape or menthol, that's illegal. And as mentioned, our laws apply on reserves. Legal challenges have not been an issue in Canada with respect to menthol. They have been for other areas, when freedom of speech is involved. Those have had to be defended in Canada in court. There was a frivolous proceeding that was commenced just as the Nova Scotia legislation was about to come into force, but it was frivolous, and there's no legal issue in Canada. In Canada, none of our laws affect flavors in e-cigarettes. So many provinces and soon the federal government will have regulatory authority with respect to e-cigarette flavors or e-juice flavors for potential future regulations, but none are affected at this time. There was a federal amendment in 2015 to strengthen the federal restrictions banning flavors in most cigars, so 6 grams or less, but they still exempted those traditional alcohol flavors, rum, whiskey, wine, and port, but menthol was still exempted. And there's some examples of cigars weighing more than 6 grams, again, flavored chocolate, grape, shows to have the benefits of having no exceptions. Now, Ontario, just to highlight this, because Ontario had an exemption for pipe tobacco in its legislation banning flavors. And so on the left, you have these big bags of pipe tobacco that are flavored, including Bullseye, menthol, pipe tobacco. Now, I'm sure it's not really pipe tobacco. It could be used to make cigarettes, and they've got this device there, that kit of flavored tubes, or not flavored tubes, but filtered tubes on the left, the Bullseye tubes. So it's like a type of way to get around it. So it just shows you the value of not having any exceptions. I don't know if there's been any material sales volume for this product. I don't know if it's continuing on the market, but there shouldn't be any exceptions. On the right are these flavor cards. So the size is a little bit smaller than a pack of, your traditional pack of 20 cigarettes. You open it, it smells a lot. And the idea is you put it in the package, you leave it overnight, you leave it for a few hours, and you can have this flavor sublimate to the product. So no provinces have banned these. I don't know that they've had any material sales volume. It'd be great to ban them. But it's not. But it has something that emerged in Canada only after we had flavor legislation in place. But, I don't see it to have any really material undermining. I don't think sales are material. We don't know yet, but I do mention that. So just to highlight again, this increase in British Columbia in those provinces. As an example of a province that did not have a ban on menthol, how there's this tremendous increase compared to historical patterns. And if you look at all the provinces that did not ban menthol, it increased from 6.2% of the market to 11.8% in 1 year. Remarkable. So this is the market share by province for 2016. And on the left, in sort of the yellow, you have provinces where it's been banned. So the market share should be 0. So I don't really know how to explain the 0.1%, 0.3%. Maybe there's just something to do with wholesale shipments that end up in another province and they didn't have the reports complete or something. For Quebec, it was banned midway through the year, August 26, so 2.3% of the market, representing partial year sales. Ontario, because their ban took effect the next day at year end, January 1st, there would have been some sales decline because of inventory depletion. And then you have the other provinces where there's just no legislation. This graph, this table, just has the data. So if you want for different provinces, it's there as a future reference. So there's one study from Ontario, a pre and post. This graph study that's continuing. And for the first month, so this only came into force January 1st, 2017. So a month later, for the menthol smokers, 15% were abstinent, were non-smokers. And 40% had made a quit attempt since the ban. And those who were primary menthol smokers, 64% of them were much more likely to had the motivation to quit because of the menthol ban versus 22% who smoked menthol occasionally. So that's encouraging. And so there'll be more data to follow. Lessons learned from Canada, it can be done. Data on youth use is very important, as is being used in the US. The arguments from the industry are mainly contraband, not effective smoking rate. Problems if not all tobacco products are covered. It would be good to ensure that banning cigarette papers is included. Provincial governments have not had to do any laboratory testing or increase enforcement resources. It's better to ban all menthol, not just characterizing levels, as Canada has demonstrated the feasibility of doing. Banning flavors in all products is important for action, and it's also helpful for advocacy to ban menthol. Packages are a tremendous advocacy tool to show decision makers in the media. We found it was contagious, and its success in one province led to success in others. Province-specific data was very beneficial in terms of youth use. If necessary, if there needs to be an interim period, banning menthol capsules or banning menthol on all tobacco products except manufactured cigarettes are options, depending on the circumstances of a particular jurisdiction, that are available to help prevent a problem from getting worse. No municipalities in Canada adopted a law with respect to menthol or flavor. So yes, there's tremendous opportunity in the US for this. In Canada, the context was different. Some of the talking points that we used, tobacco with training wheels, we add flavors to medicines that kids use to make them more likely to consume medicines. But why should we add flavors to tobacco when we're trying to discourage kids from using tobacco? Menthol is a local anesthetic. It soothes the throat, and other talking points. And often, if a menthol ban would not work, then why is the industry so opposed? Our implementation ban has been successful. It can just be done. It's inevitable. It's inevitable across the US. Thanks very much.
Wonderful. Thank you, Rob, for your presentation. My name is Joelle Lester. I'm, as Desmond said, an attorney here at the Tobacco Control Legal Consortium. And I am going to talk a little bit about the legal authority issues and litigation challenges related to menthol restrictions here in the US. So just to put this in context a little bit, as most of you know, before 2009, tobacco control in the US was largely a state and local affair. The federal government didn't really get involved too much with tobacco control law and policy. But then with the passage of the Family Smoking Prevention and Tobacco Control Act in 2009, Congress gave the FDA a large amount of authority to regulate tobacco products, and the federal government got into the game. I do just want to note, as Desmond mentioned in his opening, that while the Act prohibited outright all characterizing flavors in cigarettes, it exempted menthol and tobacco flavors from that. And so the Act directed the FDA to consider what to do about menthol, but didn't take specific action on menthol itself. So where we need to be in tobacco control is we need to have the federal government as a full partner bringing all of its authority to bear to protect health in communities around the country. We're not there yet, but we're hoping to move in that direction. So back to the Act. The Tobacco Control Act sort of divvies up authority between the federal government and states and locals. There are some areas of overlap as well, but just generally speaking, as many of you are aware, the FDA has the authority to set tobacco product standards. It can regulate the sale and distribution of tobacco products. It can regulate advertising and promotion, although the asterisk there is to just remind all of us of the First Amendment provides its own restrictions on what we can do about advertising and promotions. And the federal government deals with health warning labels. The Act states that the FDA cannot ban a whole category of products. It can't assess taxes. Federal government can, but not the FDA. And it can't restrict use of tobacco products. So on the other hand, the state authority provided under the Act is that states can deal with use. So clean indoor air laws, clean workplaces, clean parks, tobacco-free schools, all of that is within state and local authority. And then states also have the authority to restrict sales, assess taxes, and impose pricing restrictions. And local authority, of course, depends on what the state authority provides. So I'm going to use state and local generally here, but knowing what your local authority is a state-by-state analysis that we'd be happy to help you with if you have questions. And then the Act generally says that states do not have the authority to regulate the content or manufacturing. So states can't do tobacco product standards for the most part. There's a little gray area in that provision of the law, and it's highly technical and would take its own webinar to discuss. So we're just going to, for today, accept that tobacco product standards are an FDA thing. So given all those authority questions and who can do what, when we think about what to do on flavors and menthol in tobacco products, states and locals are thinking about how to take the authority that they have under the law and bring it to bear on tackling the problem of menthol. Now you might have one lingering question, which is, won't the FDA handle it? Given that the FDA does have authority to act to implement, for example, a tobacco product standard. And the important thing to note, first of all, is that they haven't yet. So the FDA has had authority and some direction from Congress to act on menthol since 2009. And it has collected a lot of information about the population health impact of menthol tobacco products, but it hasn't yet proposed a regulation to limit or prohibit menthol in cigarettes or other tobacco products. There's a little asterisk there as well, because when finalizing the deeming rule in 2016, the FDA did try to use its enforcement discretion in a way that would have gotten many of the newly regulated flavored tobacco products off the market until pre-market review could be completed. And that would have included menthol, which was really significant. But unfortunately, the White House Office on Management and Budget deleted those flavor provisions from the final rule, so no action was taken. More recently, just this past July, the new FDA Commissioner, Dr. Scott Gottlieb, announced a new direction and focus for the agency, considering reducing nicotine to minimally addictive or sub-addictive levels in cigarettes, and also talking about gathering more information on flavors, including menthol. These actions would have the potential to save millions of lives over the long term, and we absolutely look forward to engaging with the FDA on these topics as they move forward. At the same time, there is no need for the FDA to gather additional information on the role of menthol in tobacco products, as the agency has already gathered overwhelming evidence through its past advance notice of proposed rulemaking and 2 separate reviews of the scientific evidence on this topic. So initiating yet another information collection at this juncture only serves to delay an important public health measure. We hope the FDA acts soon on all flavors, including menthol. So that said, States and municipalities are not waiting for FDA action on menthol and flavors, and instead are taking action on their own. So as we mentioned earlier, the Tobacco Control Act preserves state and local authority to restrict the sales of tobacco products. And that is where the communities who have taken action so far on flavors have focused. And the action at the local level started not too long after the Tobacco Control Act was passed, actually, on this issue. New York City and the city of Providence, Rhode Island, both passed ordinances prohibiting the sale of flavored non-cigarette tobacco products. And the two ordinances differ a little bit. In New York City, the restriction did not apply to e-cigarettes, and it applied to all flavors except for menthol. It followed the exemption that was included in the Tobacco Control Act. And then it allowed limited sales in what they call tobacco bars. An important thing to know about this exemption is how narrow it is. There may have been 9 or 10 tobacco bars at the time that the ordinance took effect, but now there's only 8, and that category is closed. So there can be no new tobacco bars registered in New York City. And as far as the person at the health department I spoke with is aware of, only one of those actually sells flavored tobacco products, and that is a hookah bar. New York City was sued in federal court and won at both the district court level and the Court of Appeals, with the court finding that the city was not preempted by the Tobacco Control Act, and because the authority to regulate sales is preserved to states and communities, and that it was not a tobacco product standard in disguise, as the industry had alleged. Similarly, in Providence, Rhode Island, their ordinance prohibited the sale of all flavored non-cigarette tobacco products. They also exempted menthol. They did not exempt e-cigarettes, so e-cigarettes are covered by Providence's ordinance, and they included a limited exemption for what they call smoking bars. They were sued by the industry in federal court as well, and they won both at the district court and the Court of Appeals with the same finding that it's within their authority to restrict the sale of these products. So after these two cities led the way with a flavor restriction and won in court, some jurisdictions followed suit. For example, there are more than 80 communities in Massachusetts that have an ordinance very similar to the Providence, Rhode Island ordinance, so that covers all flavors except for menthol and all tobacco products. After a couple of years, the city of Chicago decided to tackle flavored products in that community, and they decided to also include menthol. And this is really important because there was some confusion about, or uncertainty maybe, about whether the fact that the Tobacco Control Act addresses menthol slightly differently might mean that a court's analysis of the preemption issue would be slightly different. And as it turned out, it was not. So Chicago's flavor ordinance is different from New York City's and Providence, Rhode Island's, because they did what's called a buffer zone. They prohibited the sale of flavored tobacco products, including menthol, within 500 feet of a school. So they had a lot of challenges with implementation and enforcement that I'll talk about in just a minute that were related to using the buffer zone structure. But the important thing was the city got sued. There were 3 lawsuits filed, and the court's reasoning in upholding the city's authority in Chicago was very similar to the courts in New York City and Providence, just finding that the ordinance is a simple sales restriction. It's not a tobacco product standard, and it is within the city's authority to do that. So Chicago really led the way by including menthol in that ordinance and sort of paved the way for other communities to follow suit. So this just gives you a snapshot of the local policy landscape. There has been so much momentum in the last year especially, and it's kind of concentrated in a couple parts of the country, as you can see from the map. And I actually did not have quite enough stars to layer onto the Bay Area because there's so much happening there. But certainly the momentum has built as these the pioneering jurisdictions, withstood these legal challenges and then gave other communities the confidence to follow suit. I'm going to just clarify a little bit, these are sort of the variations on the theme, and there's details that are different in different communities, even within these categories. But the buffer zone around schools is the Chicago model, and actually also Berkeley, California. They have a similar ordinance. Theirs is 600 feet of schools. The most common model lately is sales restrictions that are jurisdiction-wide, but they exempt adult-only, tobacco-only retailers. And there is it's sort of an open legal question of whether that exemption is required under the law. That has not been addressed yet in the court cases. And then the boldest version is the sales prohibited everywhere in a jurisdiction without exemption, without any exemption for any kind of product, any kind of retailer, any location in the city. And that is what San Francisco did just recently. They passed an ordinance prohibiting the sale of all flavors of all tobacco products in all retailers in the city of San Francisco. So a couple of things to remember. There's so much to be learned from the communities that have gone first, but strong sales restrictions define flavors by the characteristics of a finished product, not the ingredients or additives. Exemptions are always going to be suggested when you're considering an ordinance like this. And it's just important to remember that some exemptions can raise different legal questions, and so that they need to be carefully considered to make sure there's a public health rationale for making the kind of distinction if you are considering an exemption. But any exemption leaves either individuals or areas of a community unprotected. And I would just also note that one thing we've seen in the pushback on some of the flavored tobacco product restrictions is if you focus the whole discussion on youth, and then the community also passes a Tobacco 21 policy, then there's pushback saying that we don't need a flavor product restriction because now we have Tobacco 21. And that actually happened in Chicago. And I think that as public health professionals and advocates, we care so much about youth and preventing youth initiation, of course, but we also care about the addicted adult smokers who are trying to quit. And we know that there's many of them, and we don't want to abandon those folks. And so having the strongest possible sales restrictions in place also supports those adult smokers who probably became addicted to the tobacco products as youth, and now they're adults. And when we get those products out of, at least reduce the presence in a community, if not eliminate it entirely, we're really supporting those adult users as well. And then one final thing I would say is the public health argument for the restriction of menthol is really strong. There's been so much evidence gathered. Desmond covered some of the highlights earlier, but that's really important when building a strong evidence-based policy that can withstand a legal challenge. You're probably familiar with these kinds of elements of a strong policy. These are true of all kinds of public health policies, and certainly true in a flavor restriction. And I would just add that clear definitions are really especially important, both to avoid stumbling into tobacco product standard territory, but also to aid in enforcement efforts and to make it easier for the enforcement officers to deal with tobacco industry shenanigans as they try to evade the policy once it's in place. A little more on enforcement. That has been tricky in the jurisdictions that have flavor restrictions in place, and there's a lot to be learned from the jurisdictions that have gone first. And I really can't say enough about how much value those communities add for all of us as they try to navigate tricky legal issues and also figure out how to best structure it to maximize the health benefit, because all the jurisdictions that follow can really learn from them and structure their policies to both have the best possible health impact, but also make it as easy as possible to implement and enforce. Oh, I skipped right past. We have a lot of resources on our website related to restricting the sale of all flavors, including menthol. Tobacco products in your community. So we have a toolkit that's available on our website. I'm showing you just a screenshot there. Our website is publichealthlawcenter.org. And then hot off the presses, we have 2 new publications. We have a tips and tools for regulating flavored tobacco products. And we also have been keeping a list of all the U.S. jurisdictions that have sales restrictions on flavored tobacco products. So much is happening that that list has only been up for a couple of weeks and it's already out of date. We have another jurisdiction to add, but Phil's going to talk to you about that. And then we also have some model language on the website, a model ordinance that you can look at. That I'm not sure it's included in either of these two, but it's on the Menthol page in our tobacco control resources. Should be easy to find. But of course, our most helpful resource that we can offer to you is the individualized legal technical assistance that our attorneys provide to jurisdictions working to use the power of law to protect health in their communities. We are available to help you work through tricky issues. We are also in touch with communities that have these policies in place, and so we can help share their lessons learned and suggestions about how to best approach the stickier spots. So we hope that you'll contact us, and we look forward to working with you. And with that, I'm very pleased to turn it over to Dr. Gardner.
Thank you, Joelle. Let me just back up here a moment. No, thank you, Joelle, and thanks everybody who's still on the line. This has actually been a very monumental year for menthol restrictions. That's why I titled my talk "Moving Center Stage." Having said that, the cold facts are that the great successes that we heard about in Canada, we're just beginning to actually get our head above water here in the United States. What I'm going to do today is kind of give some background on the fight to restrict menthol and tobacco products, and essentially it's been going on for about 30 years now. Many people don't realize that. I think just with the FDA coming about, in the last 8-9 years, that this discussion has come up. No, it's been going on for quite some time. Having said that, if you take anything away from this presentation today, it's this chart where African American menthol use skyrockets. I think the point of this is that what happened in the last half a century that led to the meteoric rise of menthol use among African Americans. I would suggest to you, and pretty straightforwardly, that it was predatory marketing on the part of the tobacco industry aimed specifically at African Americans. Now, I could do numerous charts on this. Many people who are on the call probably have heard presentations from me about this. I'm only going to use this one slide to drive this point home. This is comparing Brookline in Massachusetts with Dorchester, these cities or areas in Boston. And the punchline, of course, is that there's significantly more retailer ads in Dorchester, which is a predominantly colored community, historically was more black. The ads are larger significantly in Dorchester. The menthol ads are significantly much more in Dorchester, as you can see. And then I guess the thing that is most distressing about all this is that the average price of menthol cigarettes is cheaper in the black community. I could show you slides from California on this, and I could show you national data that would confirm this. The predatory marketing is what led to that meteoric rise in menthol use in the African American community. What it also has occasioned, and part that menthol use has played a role essentially in health disparities. I'm just showing you the death rates for males over the last 15 years. Over the last 15 years. And even though rates of cancer have gone down for essentially all groups, there's still a significant gap. African American males dying disproportionately from this disease. This is also true for African American females dying disproportionately from cancer disease. Now, yes, not all cancers are caused by tobacco, but since we have just a few time, I'm just trying to make the point that menthol has played a role in the question of health disparities. So where do we go from here? What I'm going to trace for you now is essentially the fight to ban menthol. And this, as I mentioned at the beginning, has been going on for some time. the first instance where it became clear in the 1970s and 1980s that the African American tobacco market was heavily skewed toward the use of menthol, and that was because of the marketing in the tobacco industry. They began to take it one step further. So they introduced Uptown cigarettes in 1989. They were going to do this test marketing for 6 months in Philadelphia. They chose the term Uptown because that gave it certain class. It was interesting. It wasn't a green pack, which I'll show you in a minute, but it was a black and red and black and gold pack. Felt that that would give it more prestige. Of course, most of us understood what Uptown means because Uptown in New York means Harlem, and people, understood that. And the tobacco industry understood that too. It became such a problem that local coalitions led by African Americans, other health groups, exposed this predatory marketing, demanded that Reynolds actually stop this. But it wasn't until Louis Sullivan, then the Secretary of Health and Human Services for the first Bush, calls out R.J. Reynolds and publicly flew to Philadelphia and said that they should stop doing this. So with the federal government ostensibly, but not actually, but with the force of that, Reynolds withdrew Uptown products, and it never was marketed then. But it was really the local coalition, because this is a focus, that actually led to this stoppage. This is a picture. You notice it's black and gold, Uptown, the place, the taste. Of course, it's marketed to African Americans. Then there was Brand X menthol cigarettes in 1995. You need to think back in 1993, Denzel Washington had just done Malcolm X, major role that he did, should have won an Oscar for that. That's a different issue. And this group in Boston, the Strobridge Brook Distribution Group, decided to capitalize on Malcolm X and the identification of it. They developed red, black, and green packaging and began to market these around the Boston area. Again, the same thing happened. Community groups got a hold of this, found out about this, went to the city council, went to their Congress people, and actually called on this group to stop selling or promoting these products. And in fact, they did suspend the sales of them. Here's a copy. So when you look at it, it's red and black, and where's the green? Well, the green is in the cigarette itself. We can come back to that because it's menthol. Then there's the Cool Mix campaign. This is major undertaking in 2004. This was an attempt to capitalize on hip hop in the Black community. This was going to be a nationwide contest, mixing, scratching, DJing, that would take place in all major cities around the country and would culminate in a national contest in Chicago. Again, local opposition by African American groups arose that, called this out. And it was essentially lawsuits that were brought by the attorney generals of New York, Massachusetts, and Illinois that actually blocked the national meeting from taking place. These are some of the promotions that we saw for the Cool Mix campaign. The 2004 DJ Battle is on. Be there. This, if it's the music, it's the mix. So you think they're aiming it at some particular community? This is a great slide. Each one of the images you see on the screen in front of you is a separate pack of cigarettes. This was what was being marketed to promote this event. Be appraised, though, that in 2002, tobacco folks actually undertook what we call the first National Menthol Conference in Atlanta, Georgia, where folks from the CDC, folks from my organization, the TRDRP, the Tobacco Related Disease Research Program, the NCI, National Cancer Institute, and others actually gathered to meet. We did that again in 2009, and it was precisely in 2009, was a few months after the passage of the Family Prevention Act that we met. And unfortunately, menthol showed up as a sacrificial lamb, and I mean this sincerely. Essentially, the Family Smoking Prevention and Tobacco Control Act was a deal with the devil. Now, it's true, it gave FDA authority, and I appreciate Joel and the Law Center and all the different things that it's brought to us. But essentially, by excluding menthol, it threw African Americans, women, youth, Native Hawaiians, Filipinos, folks from the LGBT community, Puerto Ricans, folks with behavioral health issues under the bus. We were bargaining chip, and it was unfortunate, unnecessary, and uncalled for. Back to both presentations, everybody said, well, why is menthol so important? Why is menthol so important? You might look at it this way. The tobacco industry is in the United States is $100 billion industry. Menthol makes up about a quarter of that, or about 25 billion. So yeah, you can get rid of vanilla cigarettes and cinnamon cigarettes and clove and mint and blah, 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 but you can't get rid of menthol because it's a $25 billion industry. It's unfortunate that the people who cut this deal with Philip Morris and the Southern senators, some representatives from the tobacco control movement, went along with this, with suggestions that, well, there possibly could be black market that arise, or that we'll get back to it later. Well, here it is 9 years later, and we're only now getting even near it. There was pushback. So we became aware of this in 2008, and a number of groups were actually appalled with this. In fact, there's no small issue that the African American Tobacco Control Leadership Council was founded in 2008, and it became clear what our goal was as soon as we got a chance to look at the drafts of what would then become the new Tobacco Act. New York Times ran an interview with a number of us in May of 2008. By myself and others are quoted in there about how menthol should be part of the flavors restriction. The National African American Tobacco Prevention Network and other groups began agitation around this work. And probably significantly, Joseph Califano, Louis Sullivan, and 7 other former U.S. Secretaries of Health authored a stinging open letter to the House and Senate members. This is in part what that letter said. To make pending tobacco legislation truly effective, menthol cigarettes should be treated the same as other flavored cigarettes. Menthol should be banned so it no longer serves as a product that tobacco companies can use to lure African American children. We do everything we can to protect our children in America, especially our white children. It is time to do the same for all children. This was sent to 435 members of Congress in the House and the Senate, and it did have an effect. Following this, Donna Christensen, Democrat from the Virgin Islands, drafted in what became then the amended FDA bill, and in part it read that the first order of business for the Tobacco Product Scientific Advisory Committee that the FDA was to set up was to issue a report on the impact of the use of menthol in cigarettes on the public health, including such use among African Americans, Hispanic, and other racial and ethnic minorities. So even though we didn't get it in the actual bill, which it's true, if folks that I worked with would have been at the table, we would have had to walk out because we weren't going to sign anything like that. If they'd have done this, all the work that's been going on over the last number of years, there wouldn't have been no need. We could have been focused on other things. Having said that, we have to deal with the reality we have in front of us. So, TPSAC does produce a report. The report states unequivocally that the removal of menthol products from the marketplace would be beneficial to the public's health. Unfortunately, the Office on Management and Budget, they produced a report in July of 2011, sat on it until early 2013. This was actually, well, we can go into that if people want to go into that. Given that it was being sat on, FDA launched its own investigation apart from the TPSAC, its own report, and came to the same conclusion. Still no action. The tobacco industry then effectively sues and says that the TPSAC report is biased because members of who wrote it had contracts with the pharmaceutical industry and were pitting one industry against the other. A year later, that ruling was overturned. And why I have the term stirring at the top of this slide is that maybe something's happened. I want to thank Joelle for pointing this out, and a number of us didn't miss it. Last May, when the FDA put forward their new deeming regulations, I essentially thought they took a bold step of including restrictions on the sale of menthol and all other flavored products. It would be one, if you could get this passed for these new products like e-cigarettes, hookahs, cigars, cigarillos, and the like, then it would be a step closer to getting this done for cigarettes. But no, to add insult to 7 years of inaction and injury, 16 pages of the new deeming regulations were redlined, that is, deleted by the Office of Management and Budget, that pertain to flavors and menthol, thus exempting menthol again. You can notice a pattern that has been going on for a number of years now. I must admit this was one of the best investigative stories that I'd read in a while. I was actually in D.C. preparing for a press conference on menthol that we were going to ask, which we did, and ask Obama to intervene in this, which he didn't, by a New York Times reporter who came to find out that Andrew Perot, the White House official for Information Regulatory Affairs and Office on Management and Budget from 2008 to 2014, had been the one who essentially redlined this. He was the one who oversaw the FDA and USDA policies relating to other things, tobacco. We have documents that show that when he left employment in 2014, he was hired by the Cigar Industry Association and by Enjoy, an e-cigarette company, in 2014. A year later, he is rehired by the White House to serve again in his capacity in the Office on Management and Budget for Information and Regulatory Affairs. It is this gentleman who then does the redlining. It's the tobacco industry. There's not only a snake in the grass, it's a snake in the White House. To give a context, and I want to thank the folks from Canada with their health minister stepping up to the plate. Where we are in the United States is here. No, this isn't a picture of Donald Trump smoking a cigarette, but it might as well be. And even though his son supposedly runs his portfolio, we have documentation that somewhere between $500,000 and $1 million worth of Altria stock is owned by the President of the United States. So you see what we're up against here. This is, I appreciate, I need to say this at this point. A lot of the folks in Canada, should get it all out. It shouldn't be just characterizing flavors. Well, we're starting way, way, way back. If we were trying to get out everything, since menthol is in all cigarette products, we probably wouldn't be this far along. What are the implications for menthol regulation during the Trump reign? The Office on Management and Budget will continue to be staffed with tobacco industry surrogates. Unlikely to 16 pages of the deeming regulations and menthol flavors will be reinstated. The Health and Human Secretary, Tom Price, has taken money from the tobacco industry. Hey, he didn't even vote for the tobacco. He didn't even vote for FDA authority in 2009. Gottlieb, the new head of the FDA, has ties to the vaping industry. He once was a board member of VERE, V-E-R-E or A. Even though he's left that board, he still has ties to that industry. And then I do want to mention that, and Joelle did mention that the new FDA Center for Tobacco Product Harm Reduction proposal sees flavors and menthols as helping to reduce harm. Now, when Mitch says he needs more information, or when Gottlieb says they need more science or information, Joelle said it right. We already have the information. We already know that it's harming people disproportionately, poor people and marginalized groups. So they don't need any more. What I think is a problem is, since they're going to try and lower nicotine levels in combustible cigarettes and not in in e-cigarettes, their argument will be made that flavors are a key ingredient in people getting off regular cigarettes. Therefore, I think that this fight is going to continue. I've talked to some colleagues around the country, and we hopefully will write the FDA about this, and we could even take some questions on that. Let's be clear about who's in the White House. Jones Day is for years has been the lawyer for Reynolds, which is now being bought by the British American Tobacco. All of these people, the Solicitor General, Noel Francisco, the White House Counsel, Don McCann, Deputy Counsel Craig Caddis, and Cabinet Secretary William McGinley are all from Jones Day. So this is the level of opposition we faced. Let me move on. Local actions. Chicago, we've talked about. 500 foot, there was the first in 2013. The African American Tobacco Control Leadership Council worked with the city of Chicago, and we were able to get this done. But for various reasons, tobacco industry suing, merchants rebelling, and I would argue non-ongoing community engagement, city council and the mayor caved in. And essentially the buffer zone was removed around middle schools late last year, earlier this year. Thus, exactly where you need the buffer around middle schools, it's no longer and just exists around high schools. It points on what you have to have ongoing, we can pass a lot of laws, but there needs to be ongoing community engagement on this project. We've mentioned Berkeley, a 600-foot barrier around schools and parks. Contra Costa County has a 1,000-foot barrier around schools, parks, and libraries. These are unincorporated areas. Los Gatos has restricted menthol and flavors tobacco shops. Santa Clara County tobacco shops. Again, unincorporated areas. El Cerrito has a citywide restrictions on menthol, but won't take effect for another year. And Hayward, 500-foot buffer zone around schools. Now, we just found out today that Palo Alto passed the similar tobacco-only shops where menthol can be sold on Monday. That was the 18th. It's important, and I want to point out, Joel, this is a good paper that you guys have done, or resource on who's adopted flavor restrictions around the country. There are many places that have adopted flavor restrictions. The majority of them haven't included menthol, though. This is the real issue. West Hollywood has a barrier. There's some legal discussion about that. What is a youth-oriented area? And Yolo County, again, in the unincorporated areas. It's interesting to note that somewhat distinct from what is done in Canada, all of the ones that I've mentioned include restrictions on e-cigarette juices and all other tobacco products, these flavor restrictions. Minneapolis passed their law earlier, actually in July, excluding menthol, or including menthol in existing flavor ordinance. They exempted local liquor stores. Menthol, Oakland last night, hands out to, props out to Oakland last night, improved menthol sale restrictions to adult-only tobacco shops. Look at it this way. There's only about 4 or 5 tobacco shops in Oakland, so this is a major step forward in bringing down where menthol will be available. And it's true that some people will, transform themselves into tobacco shops since there's a year before it can be implemented, but it's still major. Be appraised that menthol restrictions to adult only at St. Paul to tobacco shops was introduced on the 11th. It is slated to be voted on next week. And Richmond, similarly, citywide restrictions introduced next week, and a number of us will be there. So things are actually jumping. This is going to be my last slide on the local, and I'm going to try and get this all done in the next 2 minutes. San Francisco, and why I say all in, the tobacco industry has gone all in, and frankly, the tobacco control movement is all in too. The San Francisco is proposing a total citywide sales restriction that nowhere in the city could you be able to buy flavored tobacco products, including menthol. And it was a unanimous Board of Supervisors vote, 11-0, to support this. The tobacco industry knew that this was happening, got their ducks in a row, joined with the Vaporist Society, and proposed and put forward that they want to get a referendum. They would have had to collect 19,000 votes in a 3.5-week period. They collected 34,000, had them verified. They spent over $700,000 in July alone. Be appraised that there's a large people's campaign committee established here. All the different local groups, the health volunteers, my organization, and others are all involved. And there's been a generous donation from Bloomberg vis-a-vis tobacco-free kids for $500,000. But let's look at it this way. If the tobacco industry is putting in $700,000 a month, and we have $500,000 for the next 9 months until this goes on the ballot, it's an uphill battle. Let me just say this, what I'd like to say. There are many other cities taking this up. I have not mentioned you. I do not want to put our work there in jeopardy. There are people at different levels of, for lack of a better term, of abstraction, and working with their council people, working with their health volunteers, working with their clergy, working with community. And even though I know who you are and you know who you are, we're going to let the tobacco industry find out another way. So there are many things local folks can do: create buffer zones around schools, restrict sales to adult tobacco shops, and enact citywide and countywide bans. Get your national organization to pass resolutions like Delta Sigma Theta did, the NAACP did. These are major, major accomplishments. And then if you're doing work in this area, conduct town hall meetings in different parts of your city. Make sure to involve as many people. Use social media, which is increasingly becoming the way to move forward. And build broad-based tobacco coalitions. I guess the take-home message I'd like to leave you with is that menthol is a social justice issue, that the disproportionate marketing and targeting of candy-flavored poison to African Americans and other specially oppressed sectors of our society is outright discriminatory and genocidal. These are the poorest, the least informed, the folks with the fewest resources. Indeed, they meet the definition of what the tobacco industry is doing, and that is preying on the most vulnerable sectors of our society. If menthol were to be banned over the next 40 years, or now in this case 35 years, over 500,000 lives would be saved. If only 30% of the people did it, and over 250,000 African American lives would be saved. So what's at stake here? What's going on here? I would suggest to you that it's our future, our children's future. Here's a gentleman on a skateboard, head backward, surrounded, not literally, actually surrounded by tobacco ads. That's where we are. That's what the fight's about. With that, I'm going to stop there and thank you. And I'm Joel, and folks, I'll give it back to you.
Thank you, Phil. And thanks again to all of our presenters. Hopefully this was a useful webinar for everyone. I learned a lot personally. You can go ahead and start putting questions, clicking the Q&A button and submitting your questions. We already have quite a few, and unfortunately, I don't think we'll probably be able to get to all of them. Before we start taking questions, I do want to say that the slides for this webinar and the recording will be posted on our website, hopefully in the next couple of days. So the first question I'm going to put to Rob. Rob, you mentioned that specifically to cigars, you guys saw a lot of packaging changes and color coding in Canada. And I'm wondering if that happened in regards to the prohibitions on menthol, or if there were any other sorts of enforcement challenges that came up.
Overall, enforcement's been great. The laws, it's been applied very well. The biggest problem has been loophole when there's been deliberate gaps, for example, to exempt pipe tobacco and so on. So the emergence of the broader flavored cigars really was before legislation was adopted and before including the bans on menthol. So overall, it's going well.
Great, that is good news. The next question I'm going to put to you, Phil. I know that, well, I'm sure you've seen it out there in California, and we've seen it here in Minnesota, but the tobacco industry has paid some people to go around and host meetings and try to assert that the banning menthol cigarettes is somehow targeting the African American community. And obviously some communities have had success despite that. We've seen a lot of communities passing laws, but I'm wondering if you think there's any particular kind of messaging that is a good counter to that argument.
Certainly, and thank you for asking the question. Yeah, this is Al Sharpton and his boys going around the country putting out the line that if you were to restrict the sale of menthol and products, that it would lead to the criminalization of African American youth. African American youth. And the problem with that is that, you know, they give the example, here's a brother sitting on a bench and the police come along and they see he's smoking a menthol cigarette and they will arrest him. Well, that's just not true. That's just false, and it's what they do. That's what they're all about. Let's be clear that this is about sales restriction. There's no possession discussion involved. Another part of their argument is that this is going to lead to a black market. Well, what's interesting, if you look around at these different places that have passed the menthol ban, there's no black market that existed. Now in New York, the plate has been the black market capital of the world, and it's probably true if you were to restrict the sale of menthol in New York City, that there probably would be some increase in the black market, but it wouldn't create it. But actually, by doing that, would probably save more lives and less children would take it up and would be better. Lastly, let's be clear that Reynolds America has paid for the tour for Al Sharpton and others like them to go around the country and do this. It's the tobacco industry who's saying that African Americans should have choice. Well, if we had choice in the first place, they shouldn't have pushed this product down our throat all these last years if we really had choice. So we've confronted them. They'll still be around. They'll be out there, and we're going to join in the fight with them. And in fact, and I'll end with this. The numerous other cities that are having this discussion, we've already talked about this. So when Al comes to town, I know he's been there in Minnesota. He was here in Oakland. He was in Los Angeles. They were in Baton Rouge. They were in New York City, did their national conference. They're ready to go. They're well funded. Anyway, let me leave it at that.
No, thanks, Phil. That's very good information. I'm going to put the next question to Joelle, and I think it's unfortunately going to be our last question because we're running out of time. We had a question about other additives that are found in cigarettes and other tobacco products, other flavors, things like vanilla and licorice. The question is, why specifically target menthol when there are other additives that are potentially having the same or similar effect in terms of initiation and cessation? But I think it's a legal question, actually.
So thank you, Desmond, for that question. I think that when we first, as a sort of bigger picture answer to that, when we're talking about restricting menthol, we aren't saying that there aren't other policies that should also be pursued, both by the FDA and at the state and local level to protect health. But however, we know a lot about the harm menthol is causing, and so that, and specifically that it's exacerbating health disparities as well. And so that is a reason it's a priority. But when you get into the additive, the characterizing flavor versus additive sort of distinction, you're getting into a legal authority question, which is why you are directing that question to me, I know. But as I mentioned earlier, the Tobacco Control Act says that the FDA gets to do the tobacco product standard, which is, say, what goes into the cigarettes and other tobacco products. And the sales restriction authority really needs to apply to finished tobacco products. And so when you get sort of into the how much of what gets to go in there, that's really more of an FDA authority issue. I would also add that it's true that there are many flavor additives that make smoking and other tobacco product use more palatable to the user, but menthol is absolutely in there as well. So menthol as a characterizing flavor is a problem, but so is menthol as an additive subliminal levels. And so when I talked earlier about working with the FDA in support of their consideration of restricting menthol in all products, Dr. Gottlieb talked about it as an additive specifically, and the possibility of prohibiting it altogether and maybe other additives. And we certainly would be interested in what the FDA's research is showing and how they approach that. But as far as state and local authority, it's the sales restriction authority that folks are using.
Great, thank you, Joelle. And we're going to wrap up there. Thank you again, everyone, for your participation. If you're thinking about restricting menthol in your community, please utilize the resources on our website, and definitely you can always call us for help on this and any other tobacco control issue. Thanks again to our panelists. Have a good day.